Honest answer is that yes, we're all facing a testing shortage. And there's a variety of things that are happening that are very promising. As you've all heard, that commercial lab capacity came online. So a lot of the larger labs like Quest, LabCorp, clinical pathology labs, and many private labs, even hospital system labs are now doing testing. But also what impacted the ability to test was the reagents that are needed, and the swab kits that are needed are also running in short supply. And one may ask why. Well, it's a global pandemic. Every country in the world is needing this supply, and it's the same type of tests. So that's why there's a global shortage of these things. More news that came out of the FDA. They've approved a new test last week that is a 5-minute rapid test type of turnaround, very similar to what we see with the flu. So that should be coming to point of care testing sites pretty soon. And then there's a couple of companies that have talked about at-home testing kits. So more and more is happening. So that's all good news from a testing standpoint.
How fast can we see those tests though here in Tarrant County?
I don't know. Unfortunately, I'm not the manufacturer. I know that FDA approved them last week, and I think it was Abbott Labs that was putting out the 5-minute turnaround type of deal for point of care, and their promise was that they were going to have about 5 million available, but about 50,000 a week was their pace that they, I think, suggested.
There's been talk of some drive-through testing here in Tarrant County. Why is that not happening yet?
Right, so a lot of that is discussions between county leaders and various community partners on what's the best route to do drive-through testing. And some of the challenges that are there is getting all the entities together to see if that's even a right decision for our local community. And then of course these new discussions about new tests started to come around. So a lot of discussions have switched over. Hey, if we can get our hands on that point of care type of testing, maybe that's a good solution. But then concerns were raised about, do we need enough PPE? Do we end up creating a situation where people are going to get exposed? So all of that is getting worked through. And hopefully we don't need to do that. Hopefully when these point of care tests come, they become readily available at the doctor's offices and urgent care facilities, so people can go to a healthcare setting and get a good result right there and then. But it all depends on availability of testing and other personal protective equipment.